Some of the kind of early learnings that we had was that the side effects were generally mild, and quite honestly, the medications that we're using to treat pain, to address spasticity and multiple sclerosis, also have side effects that are, equally bothersome for some people. So in a sense, there didn't seem to be much difference between cannabis and our other treatments out there. And there was a benefit. Here's an example of it. It actually shows us two things. First is that there's a reduction in pain scores for people with mixed reasons for having neuropathic pain when they get cannabis. And it was they got equal pain relief from 7% THC in cannabis and 3.5% THC in cannabis. So just having a little bit of THC actually seemed to do a lot for people in reducing their pain. Dr. Wilsey, who was my mentor, he then followed up the study with another study, and he did even lower concentrations of THC in cannabis and gave those to a separate group of people, and he found that 1.3% THC actually also delivered the same amount of pain relief as the 3.5% THC, which is very encouraging because low dose THC causes less high. It also causes less cognitive impairment, so people feeling like they're, they have trouble thinking, or they have trouble remembering, losing sense of time. Those are very common with THC exposure. And anywho, so a very promising finding for people who actually might want to use THC, but have worries about some of the side effects. You may not get as many side effects if we optimize the dose, and even low doses can be effective for folks. So after all this, when we kind of look at some of the data, and this is the National Academy of Sciences that put together this big review of all the literature on cannabis, they found that there is actually really conclusive evidence that cannabis or cannabinoids can help with chronic pain and spasticity and multiple sclerosis. And then they had some moderate evidence that it can help, at least in the short term, with sleep. And when you kind of dial back to 1913, when it's being touted as an analgesic, antispasmodic, and hypnotic, we find that we actually haven't come very far. We've just really kind of demonstrated that cannabis does exactly what we thought it did in 1913. Still, cannabis is not something we can prescribe. We're really focusing on developing drugs to take advantage of the properties of cannabis. So currently we have oral cannabinoids that we can prescribe. And they're both kind of pill form and then liquid form. And some of the indications that we have now are appetite stimulation, nausea, and epilepsy. But there are a whole host of other kind of drugs in development, which I've kind of italicized here, that have different routes of administration, including topical, which would be very interesting to study. We don't really know anything about that. And then what is in the, how do we deliver it? So, does a spray work? Can we make a prodrug, meaning like something that has to be kind of, you take it and then the body kind of processes it to release the active form. And then a whole host of conditions are being studied right now and the results of which have, for a variety of reasons, have not yet come out. We are doing a number of studies now looking at CBD and THC, looking at, we're not doing smoke studies much anymore. We're doing mostly vaporization studies because of interest in getting away from smoking cannabis. But all sorts of different conditions. And every year we have an announcement where we fund studies that are looking at different conditions that, to see if there's a benefit of cannabinoids. And in our last round of studies, one of the funded studies actually is looking at rheumatoid arthritis. So we are getting into the kind of rheumatology space. Nobody's approached us, as far as I know, with like a lupus study. That being said, you know, in the community, when people are using cannabis, there are a lot of potential harms. So every time we kind of make a decision about medications, we have to weigh the potential benefits against the potential risks. And these are some of the things that have come up in the literature that relate to cannabis. Lots of different things that we know actually cannabis can be associated with. Things like respiratory symptoms and even psychiatric symptoms as well. And effects on the fetus in a pregnant woman who might be using cannabis. However, you know, most of that comes from smoking. Most of it is most of the data we have comes from people who are smoking it. So we don't know if there's just a specific problem related to smoking it. We don't know what is in the cannabis that people were using. Again, these are very observational. There were certainly lots of potential for impurities in the cannabis, especially at that time, because you know, it was mostly those are from illegal sources. We think now that with dispensaries and more monitoring, or legal dispensaries anyway, and the monitoring that the state of California is actually putting in place, that we're more likely to detect impurities and problems so that people aren't getting exposed to those as well. And then again, these people were using it for recreational purposes mostly. They weren't using it for medicinal purposes. And so like kind of these weighing the side effects or understanding, putting these side effects in context is really important. Now, this is the other study that's out there that looks specifically it's a mouse study in a mouse model of SLE. And again, like I think for me, I'm taking the author's word for it that this is a reasonable approximation of SLE. We do a lot of our research with animal models to see and trying to approximate particular diseases and conditions. But in any event, so this particular study, I'm not sure, is like from a great mouse model, but it did have some kind of, I think, some very surprising results that related to the administration of cannabidiol. And it seemed that in this mouse model, and when the mice were given cannabidiol, that their renal disease or their kidney disease got worse, and that CBD may have accelerated the deterioration of their kidneys, again, in this kind of condition, in this mouse with a condition that I guess appears to be looking like lupus. Now they used high doses, but not the highest doses I've seen of CBD for these mice. So I guess I don't really know how related it is to kind of real life, but it is just something out there, and I think it just demonstrates further the importance of actually having the science to kind of understand what how to put the cannabinoids in context before people use them. And people are using them more and more. We know that the proportion of people who are using cannabis and cannabinoids for medicinal purposes is increasing. It's related to like the liberalization of cannabis use legislation throughout the country. Most states have some legal form of medical cannabis. We just kind of ask folks when they're thinking about using cannabis to talk with their doctor. When they do have it, keep it in a safe place. If it's something that might alter your ability to kind of drive, don't drive around it until you kind of know how it might affect you. Make sure you're also kind of considering alternatives to cannabis, because cannabis itself we really want to think of as a tool, treatment. It's not the end all and the be all, and it's got to be put into the context of other potential therapies that might be helpful to you. Our group is very big. Dr. Grant is has actually started the center. He's our director, probably one of the kind of internationally known cannabis researchers out there. But then everyone else here is just really kind of top notch. We're looking at a variety of different conditions. We're doing some lab sciences to really try to understand how cannabis and cannabinoids kind of work in the body. And then, of course, we do enjoy kind of getting out into the community, talking with folks about cannabis. And certainly, we have a number of studies which occur all the time. If most of that stuff is available on our website, which is cmcr.ucsd.edu.